Hello, my name is Karen Tavares. My topic is maintenance Olaparib in patient with newly diagnosed advanced ovarian cancer. Definition: it is a design in which cancer cells develop in the ovary, which divide and grow uncontrollably as in other types of cancer. It can spread to other tissue, metastasizing, and it is detected when it has already expanded to the pelvis and abdomen. The female reproducing system contains two ovaries, one on each side of the uterus.
Ovarian cancer is abnormal cells that start from your ovaries. Ovarian cancer is the second most common diagnosed gynecologic cancers in the United States, but unfortunately is the number one cause of death among gynecologic cancers. Unfortunately, there is no screening test or ways to prevent ovarian cancer, so most patients present with abnormal symptoms. So most patients present with symptoms of abdominal bloating, pelvic pressure, pelvic pain, not feeling well, fatigue, weight loss, or weight gain. They often present to their physicians, who will do a physical examination and will order a certain workup, such as imaging to better evaluate the mass, and then do a biopsy that's needed. There is no way to prevent ovarian cancer, but there are some ways to reduce the risk of ovarian cancer. Almost up to 0.25% of patients with ovarian cancer have genetic mutations that make them susceptible to ovarian cancer. If you have a strong family history of breast cancer, ovarian cancer, we strongly encourage you to seek out a physician or genetic counseling to perhaps get tested to see if you have this genetic mutation. If you do test positive for one of these mutations, one way to reduce your risk of ovarian cancer is getting a surgery to remove both of your ovaries to prevent ovarian cancer. Most important thing about ovarian cancer is that it's very important to be aware of your body and the abnormal symptoms that you're feeling, because it is hard to predict who will be getting ovarian cancer or detect at an early stage. It's very important that you seek out your provider to make sure you're getting the appropriate workup that's needed.
Application in nursing. Nursing care is defined as helping the individual to carry out and maintain by household self-care action to preserve her own life, recover from the disease, and face the consequences of it.
I take care of my patients as if they're family. I'm going to be the voice on the other end of the phone call whenever they call, or if they like to communicate through their patient portal, I'm your pen pal now.
Being a nurse, we have the unique opportunity to really hold the hand of a patient from the moment that they have a diagnosis. We're absolutely going to get things sorted out and make sure that you're seeing the right doctors and that we get you the right treatment plan in place.
The nursing staff is really with you every single day, 24 hours a day.
They take all that anxiety and all that stress away as much as they can in a very stressful situation.
I try and make them feel empowered that what they have to say is important.
And reassure them that we're going to get through this together.
Talking to patients, being able to be like, oh, are you about to go home? It looks like you're being discharged, and seeing that big smile. It's a celebration for the patient, the family, and for us.
I think if you work at MD Anderson, you're there because you love it.
It's that one common mission that we have. We're there to make cancer history.
Pro and cons. Pro: the drug can delay the return of cancer considerably after the first line of chemotherapy. Help repair damaged DNA, can cause cancer cell to die. Cons: Olaparib can bring complications like sickness, vomiting, constipation, acidity, headache, anorexia, muscular, joint or back pain, and fatigue.
Study 19 was an important trial looking at Olaparib for maintenance in ovarian cancer. And in Europe, that's actually approved for that indication in BRCA mutation carriers. In the U.S., it's not approved for that indication. We did not meet the approval standards from the FDA for that indication. At this meeting, the Study 19 investigators did affirm their findings that women that took PARP inhibition during a maintenance phase did have longer times to progression. But they also showed longer times to their initiation of second and third chemotherapies, which is an important endpoint for ovarian cancer patients, something that is important to them, how long of a meaningful remission will I have after this treatment. So something that we should continue to think about and discuss.
Issue application in Ecuador. The worldwide incidence is higher in women aged 50 to 70 years. 75% of diagnosed causes occur in women major 55 years. In 80% of women, the disease is already advanced at presentation with a low 5-year survival rate in Ecuador. Ovarian cancer rate till after the uterus and month. Lightweight, the survival rate is 40% according to studies.
And BRCA mutations. They were treated in frontline after surgery with chemotherapy, paclitaxel and carboplatin, and then at the end they were randomized 2-to-1 to receive the investigational agent, which is niraparib, or a placebo. The study demonstrated a significant advantage in progression-free survival for patients receiving olaparib with a hazard ratio of 0.30. Also, these patients had a significant advantage in the PFS2. In fact, the median progression-free survival was not reached for patients in the olaparib arm and was 41.9 in the placebo group, despite the fact that 35% of these patients received olaparib at the time of subsequent treatment. With this data and with 3 years advantage in the median progression-free survival for patients receiving olaparib, I think this should become the new standard of care for patients with ovarian cancer and BRCA mutation. So the new standard of care is now carboplatin and paclitaxel followed by olaparib maintenance treatment.
In conclusions, the use of maintenance therapy with olaparib provides a substantial benefit with regard to progression-free survival among women with newly diagnosed advanced ovarian cancer and a BRCA mutation with a 70% lower rate of disease progression or die with olaparib than with placebo.
SOLO2 was actually, the efficacy data was presented at the Society of Gynecologic Oncology a couple months ago. And the SOLO2 data follows and looks a lot like Study 19, but in fact, the data is even better. So the placebo arm had a median PFS of about 5 months. This is consistent with all of the placebo-controlled maintenance trials. They're between 4 and 5 months. But the Olaparib-treated arm was at 19 months. I mean, that is a whopping prolongation of progression-free survival. And that was the investigator analysis. If you look at the independent radiologic review, it actually goes out, I believe, to 30 months. So it's a very positive trial. It is going to the FDA. I have no doubt this drug will be approved. The quality of life data, I think, basically follows what you would expect. Patients who are on Olaparib maintenance do well. There was a concern about the formulation because the old capsule formulation required the patients take 16 pills a day. That's a lot of pills. The tablet form is much lower. And so far it looks like the tablet's going to be a home run. And then the rest of the adverse events are what you would expect from a PARP inhibitor. There's some fatigue, there's some nausea. The nausea disappears after a while. There's some mild myelosuppression. That's about it. This is this fits Dr. Beer's definition of a good maintenance drug. It's easy to take, it's convenient, minimal side effects, and it's efficacious.
Thanks for your attention.